Hi there, my name is Dr Nicola Cogan and I'm a lecturer at the University of Strathclyde and also a clinical psychologist working in the NHS. I'd like to introduce to you today a series of short videos looking at research that we've been engaged in at Strathclyde, looking at the distinctive understandings and experiences of mental health, disclosure and help-seeking behaviour among Asian students. I'm pleased to say our research was funded by the Student Mental Health Research Network, SMaRteN. I'd like to introduce you to our research team within the School of Psychological Science and Health, myself as a PI in the project, and our co-investigators, Dr Xi Lui, who you'll hear from shortly, Dr Steve Kelly, Dr Tony Anderson, and Colin Flynn, who's our manager within Disability and Wellbeing Service at the University of Strathclyde. And you'll also hear shortly from Yvonne Chau, our research assistant, who really took a lead in conducting the interviews and analysing the data for the study we'd like to share with you today. Hi, my name is Dr Nicola Cogan, and what I'd like to do just now is share with you some of the background in terms of why we went about studying the distinctive understandings and experiences of mental health disclosure and help-seeking behaviour among Asian international student population. We know that higher education institutions in the UK attracted over 48,000 international students in the 2017-18 academic year, of which nearly 45% were from Asian countries. And we know that Asian international students contribute a significant proportion of income to UK higher education institutional establishments. Yet there's very little research that's been done to specifically focus on their unique experiences and needs of mental health support, despite many studies documenting the psychosocial, academic and financial challenges faced by international students. We know that there may be unique sources of stress facing Asian international students. Psychological distress is common, yet relatively little research has been done specifically with Asian international students. We know they may face additional stressors due to the demands of cultural adjustment, yet there's serious gaps in our understanding of what is distinctive about Asian international students' experiences of mental health and help-seeking behaviour. Limited research has specifically examined mental health and help-seeking behaviour amongst Asian international students, yet it's been identified that there's an urgent need for mental health services and support, which is often underutilised among Asian international student population. And we know that there may be cultural differences and basic beliefs surrounding mental health difficulties, and that may be one of the factors that hindering Asian international students utilising supports and services that are available. So this is why we set about to conduct our research. Hi, my name is Dr Nicola Cogan, and what we'd like to do now is share with you the aims of our research project and why we set about exploring the distinctive understandings and experiences of mental health disclosure and help seeking among Asian international students. Having looked at some of the previous research literature, we were able to identify that there's a real need for further qualitative research in this area. Previous work has tended to use more quantitative, large-scale cross-sectional surveys, and there's been a real lack of in-depth understanding from the perspectives and experiences of Asian international students themselves. Most research has tended to be conducted within the United States and Australia, with very little work that's actually incorporated the views and experiences of Asian international students studying within the UK context, and to date no research which has looked at this within Scotland. So the aims and objectives of our project were really to set about understanding firstly what are the distinctive experiences and understandings of Asian international students in terms of conceptualisations of mental health. what factors influence their disclosure of mental health problems? And also, what factors may influence or inhibit their ability to seek help within one higher education institution, that being the University of Strathclyde? And finally, how can higher education institutions develop more appropriate, culturally sensitive services for Asian international students who may be experiencing difficulties with their mental health?
Hi everyone, my name's Chau, and I've been working as a research assistant for this project investigating the distinctive understandings and experiences of mental health, disclosure and help seeking among the Asian international student population at Strathclyde University. So in this video we'll be discussing the methods alongside some of our preliminary results. So the methods that we used included recruiting 10 participants and conducting semi-structured interviews on a one-to-one, face-to-face basis. These were all audio recorded and transcribed in full verbatim, and then the thematic analysis process was used to analyse the results. So for the first theme, we identified the theme of adaptation and acculturation difficulties, alongside the theme of a lack of sense of belonging. So we would describe this theme as the idea that adaptation challenges, including cultural, academic and lifestyle differences, can negatively affect mental and emotional well-being. Some evidence to support this using pseudonames include: sometimes you just want to feel comfortable and be yourself, which you may not be able to always be, by participant Alicia. And the second one, I don't feel the same, because when I switch my language to English, I am another person. I am not who I was before because of another language, by Eric. The second theme we identified is a theme of barriers in communication impacting on disclosure. This has a sub-theme of social disconnection. We would describe it as who, why and how individuals choose to disclose their problems to may be hindered by communication barriers including trust, attentiveness, perceived ability to help, relatability, expression and confidentiality. Some evidence to support this include: you are very shy, even though you know English, you don't know how to express your feelings, so sometimes it will be very embarrassing, by participant Alan. And participant Emily, when discussing her feelings and thoughts about seeking help at wellbeing services, said, I don't even know where to start. I don't even know what it is. They are supposed to help you, giving advice to us. I'm afraid to go because I don't know what to expect. Hi everyone, my name's Chau, and I've been working as a research assistant for this project investigating the distinctive understandings and experiences of mental health, disclosure and help seeking among the Asian international population at Strathclyde University. So in this video, I'll be sharing with you the second half of our preliminary results. The third theme we identified is a theme of negative beliefs, stigma and fear of judgment inhibiting help-seeking behaviour, with a sub-theme of maladaptive coping strategies. We would describe this theme as the idea that preconceived beliefs, assumptions, pressure and expectations may influence help-seeking behaviour. Fear of judgment and stigma can also lead to a sense of vulnerability. Some evidence to support this can be provided by participant Jack, who said, I didn't perceive that to be problematic at all. In fact, I think I was scared to seek help, that I was scared to be aware of the problem. Our second participant, May, also said, our culture, we do not have the environment that encourages people to have a talk with other people, about your daily life, because we think it's very private. Our fourth and final theme is a theme of integration and acceptance as facilitators of adaptive coping. We would describe this theme as integration, acceptance, time and individual growth are all factors which can help to cultivate adaptive coping strategies, and the importance of institutional acceptance and cultural sensitivity to mental health of Asian international students. Some evidence to support this include participant James, who admitted, it's just new to me as a university actually caring about people's personal lives. And finally, participant Alicia, who also said, Actually, it's a sign of strength to actually be able to understand and speak to someone about it. As a society, as a community, we need to be more sensitive and inclusive and less judgmental in reference to speaking about mental health issues.
Hello, I'm Dr. Xi Lui from the University of Strathclyde. In this short video, I'd like to briefly talk about the quantitative survey data we collected to complement the SMaRteN funded qualitative study. We carried out a series of Qualtrics surveys. These surveys were student-led. We had a group of 10 undergraduate and master's students working on this for their dissertations, and they were supervised by the research team. We collected data from 547 domestic students and 213 international students studying in Scottish higher education institutions. We are still in the middle of analyzing the data, and there are so many different ways to look into it. Here, I just would like to share a couple of key findings with you. Our initial data analysis shows that, compared to domestic students, international students reported lower levels of mental health literacy and higher levels of help-seeking intentions. For international students, mental health literacy was positively associated with psychological adaptation, and lower stigma was positively associated with help-seeking intentions. Hi there, my name is Dr. Xi Lui. I'm a teaching fellow and a student counselor at the University of Strathclyde. In this short video, I will just briefly discuss the implications our study might have on future research. First, our findings could help to generate hypotheses for further investigation in larger quantitative studies in the UK context. For example, factors such as adaptation difficulties and barriers in communication might be negatively correlated with disclosure and help-seeking. A very important issue we need to consider when planning for future quantitative studies is that how we measure the factors. Our findings suggest that we may need to develop more culturally relevant measurement tools for Asian international students. Taking mental health literacy as an example, there are very few measures for it, and they mainly adopt the Western medical model of mental health. People from non-Western cultures may have different understandings of mental health, so not being familiar with concepts such as anxiety and depression does not necessarily mean that a person has a low level of mental health literacy. Our research also provides a basis for future studies that focus on more specific country and cultural groups. Our study focused on Asian international students only because this group as a whole was understudied. We definitely had no intention to imply that this group is homogeneous, because apparently it's not. Hello, I'm Dr. Xi Lui from the University of Strathclyde. In this short video, I want to discuss some preliminary recommendations for practice based on our study. First, universities could try to develop and deliver culturally sensitive psychoeducation workshops and training courses for Asian international students. For example, programs on improving mental health literacy and reducing stigma might be especially helpful, and it is very important to take cultural factors into consideration to recognize and incorporate different perspectives on mental health. Universities could also be more proactive in supporting the adaptation of Asian international students. For example, it might be helpful to engage with them using the social media platforms that they are more familiar with. And developing and implementing peer supporter or buddy programs is another strategy that might help Asian international students adapt to the new environment. Universities could also try to build a more diverse well-being support team and enhance the cultural competence of student counselors and other staff members. Having staff members representing their groups in the well-being service might help to reduce the communication barriers for Asian international students, and thus facilitate their disclosure and help seeking.